The following segment is sponsored by Providence Health and Services.
March is Colorectal Cancer Awareness Month. It is the second most common cause of cancer death. And the American Cancer Society and Providence Health and Services recommend you get a colonoscopy by age 50 if there are risk factors or symptoms. For one Gresham man, a fall on the stairs one night, along with a year of chemotherapy, radiation treatments, and immunotherapy, saved his life. Marcus Lindemann moved from Germany to the metro area in 2016. 2 years later, he was enjoying life, living with his wife and working in the wind turbine industry when a tumble turned his world upside down.
I slipped on one of the last stairs and I really classically bump, and sat down on, on my rear end and said, oh, what the heck? So a bunch of bruises and this and that.
The this and that was blood in his stool a couple of days later. At first, he denied there was a problem. Maybe it was all the cherry soda he drank or maybe food coloring. It didn't get better, and he dreaded the idea of getting a colonoscopy.
Everyone, especially as men, oh God, colonoscopy, I don't like this idea. That's a little bit terrifying, and I don't know what's going to happen. It's that kind of thing where you really think about, it's never going to happen to me, and that only happened to the others.
Marcus's doctor wasn't too worried at first. Marcus was 46, and the recommended screening age is 50 and older. But just to be safe, his doctor ordered a colonoscopy anyway. Marcus had the procedure about 3 months after his fall.
And boom, there it was. That was the sucker punch. And they told me, hey, Marcus, you have stage 3 colon cancer or colorectal cancer.
Marcus then started an entire year of treatment, including chemotherapy, radiation, and eventually surgery. He also agreed to be part of an immunotherapy study conducted by Dr. Christina Young.
We added a special type of immune therapy to that regimen to help enhance the response to the chemotherapy and radiation, to shrink the tumor down as small as possible before surgery, with a goal actually of there not being any tumor left at the time of surgery.
Marcus was treated with immune cells that recognized his tumor as bad and then attacked and killed cancer cells.
He had quite a bulky tumor, and at the time of his surgery, all of the lymph nodes that were involved had been cleared, and the actual tumor itself had shrunk down to just a couple of clusters of cells.
Knowing what he knows now, Marcus doesn't dread the idea of a colonoscopy anymore.
My message is quite clear, guys. Do this. Ladies and gentlemen, whatever, just do it.
At the end of that tough year, Marcus was cancer-free.
If I had the choice, I would go 100 times to a colonoscopy than going through this 1 year in hell.
Dr. Young is hopeful that through trials like the one Marcus participated in, patients eventually may avoid surgeries like his. We'll be bringing these Family Matters stories throughout the year. It's all part of a Providence Health and Services public service campaign dedicated to educating and motivating families. You can find out more on our website at KATU.com/Family Matters. And that's it for KATU News at 4. Thanks for joining us. KATU News at 5 starts right now.